Well, Broward House is a South Florida nonprofit organization that provides a wide range of services for individuals affected by HIV/AIDS. The organization also offers medical care, case management, mental health counseling, substance abuse treatment, and support services to improve the quality of life for people living with HIV/AIDS. In addition to its medical and support services, Broward House also operates residential facilities and housing programs for individuals in need of safe and stable housing. They work closely with community partners, volunteers, and donors to fulfill their mission and positively impact the lives of those affected by HIV/AIDS in Broward County. Today's guest, Stacy Hyde. She's president and CEO of Broward House. She has been working at Broward House for 22 years, a long time. She will talk to us about the vital work that Broward House must continue and has been doing at the impact of an April flood, which was a 1,000-year event. And Broward House does a lot more. Welcome to Unapologetically Queer. I'm your host, Al Ferguson. I am proud to talk to some of the most interesting people of our LGBTQ+ community that are the most interesting to our LGBTQ+ community. This program is unique because it is an unedited conversation. At Hotspots Magazine Happening Out Television Network, our mission is based on the 10 pillars of the LGBTQ+ community. We're a nonprofit 501c3. We believe our history, but more importantly, our future, are based on the communities of the Black LGBTQ+ community, Latino, lesbian and queer women, trans, students and youth, seniors, HIV/AIDS healthcare, business, social justice, and faith. Well, Stacy Hyde has been with Broward House, as I said, for over 2 decades. She has witnessed and understood the suffering and needs of HIV-impacted LGBTQ+ community members. Since 2020, our LGBTQ+ nonprofits have faced the greatest challenges unlike any of our entire lifetime. A pandemic that brought services and fundraising to a dead stop. A political environment in Florida that told us, don't say gay. And then, unimaginable, a once-in-a-lifetime 1,000-year rainfall and flood in Fort Lauderdale. The challenges and the need have been huge, especially this year. So we're going to talk all about it. Welcome, Stacy Hyde. And first off, I understand you are a true ally of all who are unapologetically queer.
Absolutely, and I'm thrilled to be here.
Yes, we're happy to hear from you. I've heard you speak many times, and I'm going to refer to a couple of moments of speeches that you've done on behalf of the LGBTQ community and broadly the HIV/AIDS community. So as we all know, HIV/AIDS healthcare is part of Hotspots Magazine Happening Out Television Network's principal mission. It's one of our 10 pillars to help in every way we can to communicate the needs of those afflicted and responding to HIV/AIDS. I heard you speak many times about it, but before I talk about individual comments you've made, tell us about Broward House and what you do at Broward House for the few people that might not know.
Right. Broward House, we have been in existence since 1988, and we were in response to the AIDS epidemic. And we continue that mission today. And I really believe what we do most is we see people. And so many people walking through our doors. And it's amazing to me that still 35 years later, that HIV still has stigma attached to it. So we are an open door for people to walk through and understand their HIV, be cared for. Some who have been living with the disease for 35 years, some who have just received their diagnosis. So we provide that testing, prevention, case management, housing, whatever it is they need to find their health.
Yeah, it's basically A to Z. In services and beyond the A to Z of HIV/AIDS services. Tell us about some of the other programs that Broward House does.
So our substance abuse treatment program is vital to help people turn their lives around and again find their value. Housing is, we live in Broward County, one of the most unaffordable housing climates that there are in the country. And we are getting people off the street through an assisted living facility, through independent housing. Our goal is to get people as independent as possible and as healthy as possible.
One of the things that's interesting to me about Broward House, that a lot, I think even in the LGBTQ community, may naturally understand. It's important. You're a representation of allyship in our community. You're the ally of LGBTQ plus. Broward House does not say you must be LGBT to be a recipient of services. But what really is required of a CEO and of the organization is to understand the LGBTQ community. And when they do, they can provide the services and cares that are required, which makes them allies in our community.
Absolutely.
Tell us a little bit about that from your seat and Broward House's seat about dealing with the LGBTQ community.
I think it's creating an environment that is welcoming, and we do that in sometimes the most simplistic ways. It's when people walk through the doors. We have "We Are Your People" on our door, and when you walk in, there's just pictures of our staff doing service, and people then know they can let their shoulders down and say, "I'm safe here." They can come in and talk about whatever they want to talk about. They can be angry. They can be confused. And we are there to say, it's okay, and talk to us. Let us be your person. Because we have found that so many people have been, and I use the word discarded, which sounds harsh, but discarded in society. Thrown away. Our "Don't Say Gay" environment in Florida. So we want people to walk in the door, and we say gay, right? We say you belong here, regardless of what it is. And I think what we're also looking at is everybody has a different life experience. So we also don't say because you fit into this demographic, this is what you need. We let people tell us what they need.
That's excellent. I've heard you speak many times. Hotspots magazine, Happening Out Television, has supported Broward House in many ways through the years. But last November, for the first time ever, I went on Smart Ride. It was Smart Ride 19. I had never done it before. I've talked about doing it over and over again, and I kind of took the easy route. I went as reporter. So I had a car. I didn't ride the 165 miles, but it was quite an amazing experience. And at the end of the first day, the Smart Ride, if you haven't seen and witnessed what Smart Ride does, you must make sure you go to their website and learn more about what Smart Ride does. We'll talk more about it in a minute. But on the first evening, everyone connected with the ride overnights at Hawks Cay in the middle of the Keys. It was World AIDS Day, I believe, or close to it. And many people spoke, candlelight vigil, and you were one of the people that spoke. You were so memorable to me all of this time since about a smile and just the hope and desire to be able to smile again of one of the people that you provided services for. Tell us a little bit, recap that story.
Sure. We have people who come into our assisted living facility from the street, and they really have nothing, and a lot of times nothing to feel proud of. And this particular person had lost their teeth, and due to their health and other issues. And when I was on the ride, so I rode, this was my 18th year on the ride, and I got a text from one of our staff members, and she said in the text, if you're pushing this last leg of the ride, here's why you're riding. And it was a picture of one of our clients with the biggest smile ever, because she had gotten her teeth. And we might as well have bought her a home and everything else. And some of those things we all take for granted. Her smile allowed her to feel proud of herself, which allowed her to take the next steps. And she's still doing well today.
Yeah. When you told that story in front of all of these people, the riders, etc., you get emotional here. You were emotional at that moment, but everybody else was emotional because it reminds all of us, even in the worst of times, there are things to celebrate. And in that, it was just a simple smile is all that person wanted. And they were king of the world because they were able to do that. And Broward House was able to deliver it. It must have been a very rewarding moment for you with all of the terrible things that you have to go through. We're going to talk about a few of them. It must have been a moment of going, okay, well, it can all be worth it because of this.
It is. There's so many small things that happen every single day that reminds me this is why we do what we do.
Yeah. Well, we want to take a minute more to talk about the Smart Ride. Broward House is one of the primary beneficiaries of the Smart Ride. The Smart Ride is an ingenious fundraising effort. There's no other word. It's an ingenious fundraising mechanism for so many people in need in our community. This year, it is November 17th and 18th. It is a 2-day, 165-mile ride. It's historic this year because it will be its 20th anniversary. As I said, it's a 2-day journey from the University of Miami to Key West. Now, Miami, historic here in South Florida, Key West to the LGBTQ community is iconic. It's not a bad ride over those 65 bridges, and it's a fundraising event. It's the only HIV/AIDS event like it of its size in America that donates 100% of the proceeds to beneficiaries. Now stop and drop mic. It's almost impossible to raise money and say you've given 100% of the money that you have raised back to the beneficiaries, of which Broward House is one. As Broward House is one of those foundation nonprofits, tell us a little bit about your participation in Smart Ride, the benefit for Broward House. Yeah. Clearly you've loved it because 18 years of...
It's magical. And I think everybody who goes on the ride experiences this unity that you can't describe until you've been there. And I'm sure that you experienced that last year. To have, 500 people show up, over 500 people when you include all of the crew, supporting each other and saying, we've got this and we can do this. So it's a reminder to a lot of people about the work that's yet to be done, but also that we're a community that can make things happen if we work together. I think the ride, we have, 6 different benefiting agencies. We work together throughout Florida and we share ideas. So the impact of it goes beyond the fundraising and beyond the weekend of the ride, but all year long.
Help our viewers that have never participated in Smart Ride or have never supported it, how it works. There are teams, there's individuals, you can ride, you can volunteer, you can just support. Walk us through that.
So many ways to be involved. So one is to ride. So you ride the 165 miles and it's really doing 20 miles, 5 times the first day. So if you break it down a little bit, people fundraise. We have a goal of about $1,500 per rider to raise the funds, and you show up and it is supported. You have 100% support. So you don't have to be an athlete or a bicyclist to show up and do the ride. On top of that, the ride is supported by a crew. So crew who show up that are working in the pit stops, who are tracking the track that we go on, the path that we go on, who are covering the ride. So you can participate as a crew and also fundraise. And to make this 100%, all of the donations coming back, we also have sponsors for the ride. So people will sponsor and say what we do matters. And the sponsor allows us to produce the ride with 100% of donations going directly to care and services. And those donations are split among 6 organizations. And each rider gets to choose where 50% of and crew member gets to decide 50% of what agencies that their dollars are going to. So there's a lot of autonomy in that as well.
As I said, it's ingenious.
It is. It's brilliant.
And it is brilliant. And participating in Smart Ride 19, I'm going to be participating in, of course, this historic 20th anniversary. We have to take a moment to talk about Glenn Weinzimmer. Glenn Weinzimmer is the motivation, heart, and brain behind Smart Ride. You know him perhaps even better because he owns Bona Italian Grill on Wilton Drive. He cried like 7 times in 2 days.
Has to be more than that.
I'm heavily underestimating Glenn Weinzimmer crying on Smart Ride. But the reason is because he, from his seat, and I got to watch it as reporter, he's watching magical moment after magical moment after magical moment, far more than the $1,500 that a rider is being asked to try to raise.
Yeah.
He is watching the camaraderie of volunteers and sponsors that are helping make the food, all the food and the water and all of the support services, and all of these organizations come together to make HIV/AIDS. I come from a generation, you come from a generation where there was nothing to celebrate about AIDS, the days of ACT UP, etc. That this is an event of HIV/AIDS that is completely a celebration every step of the way.
Every step.
A little bit about your friendship with Glenn Weinzimmer.
I have said this before, so Glenn taught me the meaning of the word mensch.
Right.
And he is a true example. And he wants to create a world, and I'm not just going to say a ride, really a world where we love and support each other. That this is not about one person. And while he is truly the heart and soul of the Smart Ride and has made it happen, he doesn't want it to be seen as the Glenn Ride, right? Which is tribute to him. He wants every single person who shows up to feel like they made the ride happen. Yeah. And it takes somebody special to be able to do that.
Very special, exactly. And in case our viewers haven't heard, this is kind of quasi-official, although we'll see, his last year as executive director of the Smart Ride. Todd Del May, very welcomed in our community, our LGBTQ community, will be stepping into the role as full-time executive director. But the big elephant in the room on Glenn, that's as much nice we're going to say about Glenn, because his head's already about this big. The big elephant in the room is Glenn's goal on the 20th anniversary to raise $2 million. What do you think about that goal?
I think that it is ambitious, and I think that it is doable.
Yeah.
So
ambitious and doable.
Yes.
Those are two very good words.
And I think that there are so many people who have benefited from the ride, whether that is clients, people living with HIV, or people who have been on the ride where it's just inspired their lives. And I think that in this time where we need unity so desperately, that people are going to show up and make it happen.
Yeah, yeah. Ambitious, yes. Whether you make it to $2 million, I don't think that that's really the fundamental guiding principle, but it's doable in that it's possible. And every moment up to November 18th, I'm going to think about the possibilities of this ride, 100% give back to the beneficiaries, being $2 million. And we all, goodness, hope that happens. One other thing that I think is super interesting is you mentioned the organizations, and let me do it. And we're going to, of course, give some love to all 6 of them. Yeah. Pride Lines, which is arguably one of the state's top young people's organizations for LGBTQ community. Orlando's Miracle of Love, which is dedicated to HIV issues in communities of color in Central Florida. Of course, Compass Palm Beach, which is our basically Pride Center in Palm Beach. They put on Palm Beach Pride, and principal service provider for the LGBTQ community for HIV/AIDS in Palm Beach County. A.H. Monroe, especially focusing on housing needs. As difficult as it is in Fort Lauderdale, then there's Key West. And to live in Key West is just a monumental chore. And then Empath Epic in Tampa Bay. And so there's lots of representation in South Florida, Compass in Palm Beach, but in South Florida, Broward House. How do you feel about being the recipient for Smart Ride here in South Florida?
I feel proud. And I also feel a level of responsibility. It is up to us here to show people what the dollars do. and the lives that it changes. So to the impact we have over that weekend of the Smart Ride, we then take that energy and make sure that there's an impact for the rest of the year. So there's a responsibility to that Broward House embraces, but also takes serious, that this is our role and it's important.
And one of the things that, and I have talked about this both publicly and privately in so many different ways, how has Smart Ride been able to break through the natural competitiveness that we see in LGBT and fighting for every dollar, and the natural competitiveness in a business environment where you can get Smart Ride and these 6 beneficiaries to all come together in such a collaborative way? How has that been accomplished?
The first thing that pops into my head is probably not the right answer, but we like each other. And I think the fondness for each other is that everyone involved, all of the 6 organizations and the Smart Ride with Glenn in the lead, we believe so desperately in our missions. And our missions cross over. We want to make lives better for those living with HIV. We want to see a day when we just ride for fun and we're not raising money because HIV has been taken care of. So I think that our fierce dedication to those living with HIV allows us to put everything aside to make sure that we can make the biggest difference that we can.
You know, I just cheer those words, because having been here in South Florida for 5 years and having kind of a more global viewpoint to community, our community could study Smart Ride and the beneficiaries closely, because there's so much value in the collaborative work together mentality. All boats rise together.
They do.
It's a representation. The last thing I want to say about Smart Ride, and then I want to talk specifically about some of the challenges you've faced this year, is sponsorship. The Smart Ride is able to give 100% back because of the rich and diverse sponsors, and leading the charge is Community AIDS Network, and their principal sponsorship now partnering because of the Access of Midland Medical. Tell me, from your standpoint as a provider, what organizations like Community AIDS Network means to you.
I think to be able to have physicians who care is important. And then for those organizations who are providing the medical care directly to turn around and then say, we need to do more. There's more to be done. For HIV, providing medications is one step in providing medical care. Without the support services, people don't follow through. So that our medical providers and organizations are not just making sure we have good docs, but they're also making sure the community is strong is vital.
Yeah. Do you think we, in terms of HIV/AIDS, we've done a lot of reporting at Queer News tonight, the commitment of zero transition by 2030. Where do you think we are, specifically talking to LGBTQ community? Broward County, Miami-Dade County is #1 new transmission in America. Broward County is #2 in new transmission. Where do you think we are in terms of HIV/AIDS from your seat at Broward House?
Not as far as I thought we would be, to be honest. I still am hopeful every single day, and we see people walk in, but housing and substance use and mental health continue to be a challenge for the population that we're serving. People are still being told that they don't matter because that they're a gay man. We see our men of color who still can't say out loud and identify as gay. So they don't get the prevention messages. They don't get the care that they need. There's so much stigma that still surrounds this.
There's a lot to do.
We still need to do so much work.
Would it shock you as an older, privileged, white, gay man on Wilton Drive, and those are all categories, check, right. That a very sizable percentage of my peer group would say, HIV is, what's the big deal? It's over.
I've heard that. And I've actually had somebody say to me, Broward House doesn't serve gay men. And I said, well, I can show you that we do in large numbers. And my response is we do, but it's the people you don't want to see.
Yeah.
And recognizing that our youth don't recognize the impact of the disease still, that I had I think it was 56-year-old man who was newly diagnosed, said, I can't say anything to my friends because they're going to say I should have known better. So he hid it and didn't have the support he could have had. So I'm not surprised, and it's figuring out how to get that message out that this is still an issue and we still need to care.
It for sure is still an issue. In Broward County, we're number 2 in America. Miami-Dade County, we're number 1 in America. It is still an issue, no question about it. Let's talk about a couple of the challenges that you as executive director have faced. First off, in 2020, I don't know if you heard about it, but there was this little thing called COVID-19.
A little bit.
And it brought the world to a stop, brought us off the streets. I knew, when I think back about it, I remember a day where I was walking on Commercial, and there was nothing to do, and I walked all the way out to Lauderdale by the sea, over the bridge. I did about 10 miles on Commercial. And I think in the course of a 10-mile walk, I saw maybe 3 cars on Commercial. Okay, all right. So I went through that, and I fell in love with Netflix and everything else that I fell in love with in my home. But still, Broward House had to operate and provide services, and really critical services. How did you get through a pandemic?
We did not skip a beat, and I think part of that is nonprofits are used to a struggle. Whether that's our revenue,
You're just built for it.
We are, and I think that we responded in a way that other types of businesses couldn't respond, because we were used to. We run an assisted living facility. It changed the entire way we do business, and our staff just said, "Okay, what do we do?"
Yeah.
And there wasn't any pushback, and people showed up. So I think our staff are made a little different because there's a passion to what they do.
Yeah.
And then when you talked about the Smart Ride, I reached out to Angus and to Scott and to Victor and to Julie and said, all right, what are you guys doing? So we also had this community that we talked to each other, reached out to Robert at the Pride Center, and, we talked to each other and supported each other in being successful.
It's interesting to me, on January 7th, 2020, we launched Queer News Tonight. Now, we had this very successful, it's happening out for a number of years, but we launched this daily evening news show. And one of our anchors died of COVID and was hospitalized just a couple of days after the program. But Queer News Tonight broadcast our daily schedule from the beginning of pandemic all the way through pandemic. And sometimes in a really kind of petty, immature way, we said, why didn't we get more recognition that we continued to be on the air? We were still on the air. And at the end of the day, we said, well, that's really kind of dumb to think that way. We just did it.
Right.
And for you, did you ever feel that kind of, gosh, I just can't believe that the community is not going, look, we're working through this and we're not getting the support or the recognition that we should for the amazing work that you continue to do?
I think maybe not those exact words, but I did about our funders. And I thought they need to take, so we're grant funded, and a lot of times they don't recognize the complexity that goes into what we do. And how we make it happen. But it was really just, when the client walked through the door, we knew we needed to be there.
Yeah. Well, finally we got out of pandemic and everything's been perfect for you ever since. Oh,
sure.
Oh, wait. Oh, wait.
We'll go with that.
This spring brings a record April flood caused by havoc in Florida, especially in Broward County. There was nearly 26 inches of rain, I believe, was the number in just 6 hours. And We were broadcasting it, It's Happening Out, and we were trapped in the studios for 14 hours. We could not get out. And I thought, okay. And even at the time I thought, oh, this is a lot of rain and it's a lot of water. But I had no understanding of what was really going on all around us until in the next days I find out one of the principal organizations that are dramatically affected is Broward House. Tell us about what happened to you in that dramatic rainfall and flood.
I've not seen anything like it, and I was at our Broward House assisted living facility during Wilma. So that evening, it was about, I don't know, 5 o'clock, I was at our Wilton Manors office, and one of our staff who was at our administrative offices in downtown called me and said, Stacy, water's coming through the walls. And I was like, all right, let me go get my shop vac. I'll be down and we'll clean it up.
No understanding.
No understanding. And I live up near Pompano, and turned around, couldn't get to our assisted living facility. And by that time, the nurses were calling and water was rushing through our doors at our assisted living facility, and there was no way to get to them.
That sounds like an emergency too.
It is an emergency, and there was no way to get to people. I talked about the resiliency during COVID. Our staff remains resilient, and our clients. People stayed up on their beds. The nurses kept everybody safe until we could get there the next day. Showed up the next day and couldn't get into 3 of our buildings because the water was knee high. Sitting water. And in our assisted living facility, the entire facility, all 26 rooms, our kitchen, our dining room, our behavioral health center, were just covered in this like dark, dirty water. And we just started to clean. I learned how many of my staff have shop vacs. And we started to clean. And it was one of those moments, I think you just said something about like, it slowly dawned, like, this is serious. And I just thought, oh, we'll clean up and we'll be fine. Then the air conditioners were damaged because of all the water, because they're a T-Pack low machine. Our generator was damaged and didn't work, our hot water heater. And I thought, we got to get people out of here. And we made a lot of calls to the city and the county to get people moved. So that was on a Thursday. By Sunday, we had everybody evacuated from the facility. Which included delivering 3 meals a day to people, getting people in wheelchairs to a new place. And we are still empty today.
The buildings are empty.
The building is empty today.
Yeah.
So we have 5 buildings that are empty right now.
And it's interesting to me, we finally got out of our studios, which is where Stacy is right now. We got out finally about 8:30 in the morning. And it was an arduous. Our studios are here at Sunshine Cathedral. We are really in dead ground zero of where the worst of the flooding, the shots that you saw nationally. But even in getting out, which was very difficult, I had been here about 18 hours in total. Got to the interstate and then got off at Commercial, and there was water. But all the way home, it never dawned on me. I wonder what people like at Broward House are going through right now. Yeah. Did you feel isolated from the standpoint of the world doesn't even know what's happening to us?
Yes, and in another sense, I didn't know. I thought every place was being impacted because it was from that Thursday to the following weekend. I was there really almost 24 hours a day, and didn't see any news, didn't realize the rest of the world the rest of Broward County wasn't as impacted as we were. So it was a very isolatory feeling. And our staff and our clients, like everybody just jumped in to do the best that they could. That weekend we had volunteers show up in this dirty building, helped us pack our client belongings so that it was done respectfully. And we really had some people really show up for us though too.
Tell us a little bit about how Broward House is recovering today. What are you doing?
So when it first happened in April, this is July now, right? I said, I think
it's just a whirlwind.
It is. It's just I think it's still 2023, but I said, you know what, we'll be open in about 3 months was our estimate. And we're now in July. I keep saying 3 months. So we did get somebody come in to do the recovery, and as they took 4 feet down, which I now know is the flood standard, we found mold in our walls. They're old buildings. We've been in them a long time, for over 35 years, and we kept finding more damage. So we can't take people in right now. We have about 30 people we're still serving off-site in temporary housing, but we have studs to repair that now we have to bring up to code once you start to do that. So with our insurance, we have insurance, but we're finding all the gaps in insurance, things that aren't covered by insurance, bringing things up to code. And then loss of revenue, because we're maintaining our staff. We're at about $1.5 million.
Oh my goodness.
That
And
we're raising.
For a small nonprofit 501c3, that might as well be $1 billion.
It might as well.
Yeah.
It might as well.
Yeah.
It's been significant. We've been fortunate. We've been able to raise just over $600,000, but we have a ways to go.
You're halfway, or a little less than halfway.
A little less, yeah.
Yeah. Are you optimistic you're going to be able to accomplish that?
Yes, because there's not an alternative.
Yeah.
If we don't open,
It's either yes or there's no other answer.
right?
Yes.
Yes. If we don't open, we are really a lot of times the last place for people, and they deserve our housing.
Yeah.
So we will make it happen.
Yeah. I'm curious for you, Stacy, all of the things that Broward House faces, I bring you back to your story, that you get emotional in this interview, and last year at Hawks Key and on the first evening of Smart Ride, was just a smile, and it made it all worthwhile. Do you think you'll find the kinds of things out of the story that you just told, of this once in a 1,000-year flood, where you'll find a time where you'll come back and go, yep, we did it, and
Yes.
you'll find the smile?
Yes, I've already had some smiles. We had a gentleman who it was Long-Term Survivors Awareness Day, and he did a video, and he was in the flood. He's now living in the AHF's Broward Village, which is like a hotel room, and he talked about how fortunate he was, and that he's living his best life. And I thought, man, if he can find gratitude in this, we should all be able to find things to be grateful for.
It reminds us how grateful we should all
Definitely
be.
grounding.
Exactly, grounding. Help us understand, what can the community do? What can we do to help Broward House?
So we are honestly looking for donations. There are naming opportunities. So this is a great space for also businesses to be involved. If businesses have matching opportunities for their employees. So we're looking for the $25 donation, but we're also looking for the $250,000 donation. We have one coming in August that there's a match that's going to be put out to the community. It's sharing our story with people. If you're unable to donate in this time, to share our story with people who may be able to support us, and to continue to believe that those living with HIV deserve our care.
Yeah. It's interesting to me when you say that. When I tell this story about being so inconvenienced of having to be in this studio overnight, one of the people, John Hayden, slept in Faye What's Bed that she does her show from. She had a big SUV, so she was able to get out because she was so high. And we had standard cards, and we couldn't. And I was so inconvenienced of being here for 18 hours, and then I went home.
Right.
And I feel guilty from the standpoint of going, wait, there's a much bigger picture here.
Yeah.
How do you think community is going to respond? The LGBTQ community, how do you think they're going to respond for Broward House?
I think that they're going to step up. We've talked recently at Broward House about that. A lot of times we do what we do quietly, because we believe so much in the mission, that we do it quietly, and people don't know our struggle. So I think as people discover our need, that the LGBTQ plus community will step up, because I believe in that community.
Well, and the question is always, if you don't, who will?
Exactly.
And so if something happened to Broward House, Who would fill those shoes? Very likely no one. Stacy, very interesting. We encourage you to go to browardhouse.org. You can learn all about this story. You can learn about their mission, what they do for our community broadly, what they do for the LGBTQ community specifically, what they do for HIV, AIDS, and all of the other services they provide. And for today, what they do to even exist and therefore move forward to thrive. Stacy has last question related to all of this. Everything that you've gone through, this is such a momentous year of the 20th anniversary of the Smart Ride. I know how much you're looking forward to that. But these challenges of navigating and going through pandemic, seeing the optimism of finally that ending and some normalcy coming to Broward House's life, and then this once in a 1,000-year event for Broward House. Did you ever get to a point where you thought, gosh, maybe I shouldn't be doing this anymore? No. Never crossed your mind?
No, because people need us. And I don't have that luxury to have that thought.
Yeah.
I met with breakfast with somebody recently who I was his first case manager 25 years ago. And he said to me, you just took control when I needed somebody to take control. And Broward House needs to continue to do that, and I need to help Broward House do that.
Yeah. I challenge all of my friends that are on Wilton Drive that will watch Stacy Hyde, and remember, you are very, very lucky. And there are people in our community that need your help right now. And Broward House is one of them. So again, we encourage you, go to browardhouse.org and follow them. You can follow Stacy and everything that's going on at Broward House at any of the @Broward Houses at any of your favorite social media. Stacy Hyde, I look forward to participating with you at Smart Ride 20, November 18th and 19th. Ride for Broward House. Pledge for Broward House. But above all else, participate for Broward House. Stacy Hyde, thank you for joining us on Unapologetically Queer.
Thank you.